Hey everybody, my name is Hallie and I'm a licensed funeral director and embalmer here at Edwards Funeral Home. And today I'm going to talk about the process of embalming that we go through typically here at the funeral home. So to start with, whenever we get a death call, the first thing that we do, of course, is go to whichever facility the deceased is at and pick up the body and bring them back straight here to the funeral home. After we get them back here to the funeral home, they're typically on a cot. We'll move them straight from the cot onto our embalming table. The next thing that we do is pretty much the most important part is we cleanse the body. We cleanse it with a pretty high-powered antiseptic, and what this does is get rid of the main bacteria and everything that's on the body, anything that could potentially be hazardous to anybody else, including myself and other people that are working with the body during the embalming process. After that is done, we then do a case analysis of the body, and what that is kind of examining the body just to see what types of fluids you're going to need, if the body's emaciated or if they're swollen, to see what type of chemicals are going to react the best to give you a successful embalming. So the first thing that we do is we check for color and we check for tissue retention and that kind of thing. On a normal case, the main fluids that we use is called a 1 point, and this 1 point, there's different companies that make different things, but it's typically the same. This is actually from Pierce Chemical Company, and it's called a 1 point, but it's an anticoagulant, and it is either used as a co-injection or a pre-injection. And a co-injection is just as it sounds. It goes with your typical formaldehyde solution, so it goes together and works together. So you won't have to do anything before. A pre-injection is used before you even start the embalming process with your formaldehyde. The way that we here at the funeral home use our 1 point is we do it as a co-injection. So we do our formaldehyde solution with your anticoagulant working together, and most of the time we feel that it gives you a better outcome altogether. The typical solution that we use is a Care 18 solution, and the 18 is just the index of the formaldehyde, and this is a mild to moderate solution. The higher the number goes, the stronger the solution. We have a solution that's up to 36, and that is a very strong solution, and we typically don't ever hardly use that unless it's a very hazardous or a case where the body is severely decomposed. The next thing that we do is we see if there's any emaciation or any fluid retention or anything like that. Usually if a body has been, if someone has been really sick for a while, and if they've been on a ventilator or anything like that, they hold a lot of fluid. So what this is called is an edema eliminator. And it reduces tissues and swelling without actually wrinkling the skin. So it really helps to take away extra fluid that's built up in the skin, and sometimes when people look really puffy, it really takes that away from them. So after you've done everything as far as looking and see which kind of fluids that you're going to use, you then have to set your features. Because if you don't set your features first, it's going to be too late after you start the process, because typically formaldehyde will firm the skin and the tissues, and you will not get exactly what you want if you try to do this afterwards. So you look at the body and you make sure that the eyes, nose, mouth, and everything's set according to your preference. And usually everything is always seen. You can kind of see how the caskets are. People view the body on the right side. So when the body is laying there, you typically want the head tilted about a 15-degree angle towards the right. If they're facing the other way, they're going to be looking towards the back of the casket, and you typically want them looking out towards people. So you get everything adjusted and get everything exactly the way you want it. A lot of times, sometimes the eyes pop open, sometimes the mouth pops open, but that's something that you kind of deal with after the process if it's a continuous problem. But that's something you can worry about later, and we won't get into that. But on a typical standard case, the main artery and vein that we use the common carotid artery and the jugular vein. The artery is used to inject the fluid, and the vein is used to drain, I guess, just blood and other fluid away from the body. So you start by mixing your two chemicals in your embalming machine, and the reason that we're not in the embalming room today is that we actually have cases in the embalming room, and for confidentiality, we just can't go down there today. So that's why we're up here in the casket room, but we're still at the funeral home, so it's fine. So you start by mixing your fluids together. We usually start with everything just is different. But what we do is we have 2 gallons of water, and then you put your 2 bottles of your 18 and your 1 bottle of 1 point, and you get your fluid mixed. After that, you find your clavicle bone, and that's where you begin to cut. And it's a process that you can't really explain. You just have to do it. So you cut and you find your artery in your vein. Once your artery in your vein's found, you make a small incision and start injecting your fluid into the artery. Once the fluid is starting to inject, you actually have a tube going into the vein that goes directly into the heart, and then you start pumping your fluid out. So if it's a typical good case, the fluid is going to go through the artery and circulate through the body, and the blood is going to come out of the vein, and your body will retain all the embalming fluid. That's typical. That's what we want. A lot of times that doesn't happen, and then you go to where you do like plan B, plan C, plan D. You don't want to do plan E, but sometimes you have to. But after the process is over and all the fluid is out of the machine, you take your everything out and you sew everything up, and you make sure everything is just the way you want it. You have to suture up the incision. Usually we use a baseball stitch, so you suture up your incision. Place cream all over the face and all over your hands. Anywhere that's going to be viewed by people we tend to put a lot of cream on. Formaldehyde is a solution that's going to dry out everything. It's a very drying solution, so it's going to dry out your skin. So if you put cream all over the face, it tends to help with keeping your skin moist, and that's really important for the cosmetic part of the operation, which in my opinion is one of the most important processes of the embalming process. And I don't know what else you want me to say.